Peter van Wensveen went for what was supposed to be some routine medical tests before embarking on an Inca Trail trek in Peru. He was 51. Peter and his wife Meredith have been married for 40 years. They've always been passionate travellers. Out of nowhere, the tests found an angry, aggressive prostate cancer. 11 years later, he's in palliative care. His initial reaction to a fearful diagnosis set the pattern for the next 11 years. He pushed on with the Inca trek.
We had a great need for a distraction, having just received a cancer diagnosis and a period of 6 to 8 weeks where we had to wait because of the invasive nature of the biopsies. So we had time to kill. We either spent that time pacing the floors at home or we set off about the adventure that we've been planning on.
Did you think about it much over there?
It's a funny question. It barely entered my mind in 4 weeks. It was the best distraction I could ever have had. I was so filled with the stimuli of South America that I'd forgot about home for 4 weeks, which was an absolute blessing. Yeah. So it was good. Yeah. A great holiday.
But the diagnosis and the prognosis wasn't good.
No, my my meds were bad. My bios were really bad. I had really poor pathology. I had a Gleason score of 9, and that was the real killer. That means aggressive. It was staged. It had already got out of the prostate.
9 out of 10.
9 out of 10, yeah. So there were. I don't think there is a 10 out of 10. So it was as aggressive as it can get. So I had a fast mover, and that's what we had on our hands.
With a science background that you have, tell me briefly what it was like navigating all that over the last 10 years.
In the situation of getting a cancer like that, you can have two choices. You can whip down to Bunnings and buy a shovel and go home and dig a hole and stick a head in it, or you can empower yourself, particularly with the internet these days. There's so much to learn, and I think men don't understand the difference in their outcome. If you decide to empower yourself, that you can alter your outcomes dramatically. So that's the path I went on, and my youngest son actually picked up on it, as my two other sons did as well. But we set about learning about the therapies and what options we had, because it's a minefield, absolute. The more you knew, the better you were likely to make a good choice.
Fast forward to just a couple of weeks ago, you found yourself here in Naringa, mm-hmm. in a great deal of pain, mm-hmm. in palliative care.
Yeah, we had for 11 years we had this thing under control, and we were using a hormone treatment, and it seemed to have just made the cancer become virtually dormant for a long period of time. We monitored it very carefully, and we took yet another holiday, as we want to do. We went to Iceland this time. So 12 weeks ago I was jumping into a river in Iceland on a whitewater rafting trip with 3.5 degree water, not knowing that my cancer had suddenly gone completely, can I say apeshit? No.
Absolutely.
Probably not.
If that's the truth, say it.
Yeah, and unbeknownst to anyone, what had happened is the cancer itself had morphed and become a little bit more like an endocrine cancer. So I had cancers that were coming out of my bones because I had previously been scanned, and I had bone metastases everywhere. So I found myself tied up in weeks of endless radiotherapy, which of course was doing nothing for my disease. It was spot firing all the little outbursts of fire, and I started to fatigue from going out there. I was very concerned because all the time, that whole trip and now, my tumours were growing. No one knew where or what they were. So I have a friend who works here as a palliative care nurse, a very close personal friend, and she said, we need to get the palliative care team in. And that was the first time that word was mentioned.
What did you think when you heard that word?
Well, for me, palliative care meant is where you go when you're not really going to come out. It's where they take you off and you quietly disappear. Now, how accurate that turned out to be eventually was way inaccurate.
The term to me meant you go into this hospital facility and you don't come out again. That was where you died. So it was a pretty scary thing.
What have you found since?
The complete opposite. Peter came in really very, very ill. They've told us since that they didn't think he'd last that first 24 hours.
When Peter came into Naringa, he was in a lot of pain. In fact, I'd really say that it was a pain crisis for him. He'd had escalating pain at home over a number of days. He'd not been able to sleep properly. He was very anxious about what this actually meant for him. He was really overwhelmed.
And the prospect of coming to palliative care was also a very confronting thing for both of them, both Peter and Meredith.
Yes, I think they were very uncertain what to expect, and I think their experiences from other people they'd known meant that it really spelt the end. So they were really fearful and expecting the worst.
Fear then became one of the big factors in this story, became one of the big drivers, because I think everyone's scared of death. And there's this raging debate about euthanasia, and I was very pro-euthanasia. I thought, why can't an adult who's examined the situation have the ability to make that decision? But I didn't realise there was another option. And Victoria, who is my palliative care friend, started to talk to me about the fact that no, there is another option and you don't have to be scared. And that was really the start. I had a palliative care team in my home in an hour, a doctor, Phil McCauley, with all the time I needed. He was there for 2.5 hours to talk to me at length, focused on me to find out what was wrong, how were my medications being managed, and what sort of a plan could we put together.
That's to deal with the disease and all those issues.
To deal with the fact that I had a cancer that was running out of control. Another group of medicos were off radiating me at every instant and saying, we're going to get this, we're going to fix your shoulder, just come 6 times, here's your course. And every day they'd bring me in and I was just like a whipping boy. Yeah. I knew all the staff down there. I had just about have a name on the bloody cutlery. I arrived here, I was almost a non-event. They wheeled me in here, it was about 12 o'clock, I was gone.
In terms of what was happening with palliative care, what was that doing for you, apart from the disease?
The fact that palliative care suddenly came on board meant that things were now, the focus was starting to shift on the disease that was happening. I had some people now that was hearing what I was saying. I've got a disease, by all means toast me, make these things shrink because I'm going to lose veins and arteries and whatever, but somebody has got to get a grip on what's going on in the background here. These guys have a plan. From the minute I came in here, I have had the fear completely lifted and taken away from me. And I likened it to hurtling through space, which is what I felt like when I came in here, plummeting towards the ground, terrified, and just having 1,000 hands come up and catch me and slow me down.
So, over the coming days, how did you see them change?
I saw dramatic change in them both, and really that was because Peter's pain was dealt with. He had such severe pain when he first came in that he really didn't have any headspace to think clearly, and he was really struggling. And once we'd got the pain under control, it was really like he was a different person. We were able to open up a space for them, almost like a breathing space, I would call it, where he was really able to explore what was important to him and to talk with Mary, his wife, and his family, and look at the future to see what that might hold for them both, and also to spend time in the present and enjoying what was actually on offer now with him and his family. So it was really a transformation. And I think that this came about because there's something about what I'd like to call generous listening being able to really listen to him and creating a safe enough space for him to actually feel that he could really unpack some deep and meaningful issues.
Now he's feeling so well, just with the adjustment of pain management and just the positive attitude that they exude here, that he can come home.
That's been such a surprise for both of you, hasn't it?
Very much, yeah. We didn't expect. I didn't expect Peter to look as good as he does today. 2 weeks ago, things were pretty dire.
What's it done for you?
Well, it's given me a bit of a break from being a carer because that was a daily thing for some months before he came in. But it's also, I don't know, I think it's given me hope that, things can get better. They don't always have to get worse.
Even though he is nearing the end of his life.
Any extra time, anyone I think who's dying will tell you that any extra time with family and friends is precious. And we have so many wonderful family and friends, I can't tell you. My freezer is totally full of food. That, spending more time with them is just going to be fantastic.
They were competent, compassionate. They somehow, they were so focused on getting my situation under control. I don't know, it just lifted. I apologise because
You don't have to
I
apologise.
don't want to do them justice.
But they were helping you as well as the disease, and that's two things.
They were and are the most uplifting group of people. And you can't help but absorb that.
Peter says palliative care has actually given him something to live for.
This is a confronting question to ask, but what was going through your mind about dying?
This is it. It's this issue of dying and the fact that, it's a final thing and it's scary and, some people deal with it by going to Mexico and getting this Nebutol and I thought, God, this disease is now telling me that my time's starting to come up. I better start thinking about this thing. But when I got in here, the first thing they did was they took all the pain away. Like physically, they adjusted my meds. They completely did a new regime. My doctor was asking me this morning, she said, what about pain? I said, pain became a non-event. It did. Prior to that, when I was going and dragging my sorry bum over to the radiation, I was in extreme pain most days. If I hadn't taken a drug, I was in excruciating pain. Well, that was done in 2 days. You're now in a situation where, okay, death's going to come to you, but before you thought you were going to be screaming and crawling the walls. Now I'm going to tell you that you'll be comfortable for a start. You're already experiencing it. I'm thinking, yes, I am. I'm not hurting anywhere. I am going to suffer a major function because the cancer's done a lot of damage to me. But I've already made the decision that when I get to the point where they go, we talked about that leg, those legs are going to go, or in fact a clot has formed where we thought it was going to be, do you want us to contact the relevant emergency department and send the ambulance over there, or do you want us to keep you comfortable as you are and just eventually you'll probably drop off to sleep and we won't see you again? And I thought, fucking hallelujah. That's the answer. So now I don't have the pain, nor do I have the worry. So why don't people know about this? Why do people not know that the medicine that's practiced here has advanced so much that I likened it to travelling up the Pacific Highway in the old days. You go on a surf trip on the 2-lane Pacific Highway, and if you rough old road, but you get there eventually.
For a long time.
2016, hello, look at anaesthesia and pain management and palliative care. The practice of that arm of medicine, has that changed? Put yourself on a 16-lane autobahn and put yourself in the 16th lane and the view out the front, mate, it has changed a whole lot. It's another story.
What's it changed for Meredith, your wife?
Well, I guess for her, she knows I'm in the best possible... You know what it means for her? She needs me sometimes to be the strong person, and if I'm not, it's really difficult for her. And what this has given me is the most enormous clarity and sense of purpose and a clear-headedness that I think I've ever experienced in my life. And so I'm in such a good headspace that she bounces off that, and she feels happy, and she's not worried because she bears a big load. So the place is just a godsend.
In the months ahead, as you reflect back on this experience, what is this experience going to do for you in coping without Peter?
We've had time to have some really heart-to-heart talks, a lot of crying on each other's shoulders as well. But, I didn't know particularly what he wanted for a funeral. And we've talked about that now. And, we've talked about the future for me, how I'm going to live my life without him, because we've been together since we were mid-teens. So that's going to be a really big step, and we've had a chance to discuss it.
What will that mean for you?
We've been able to, just reflect on things, look through our life, and so I can take those memories that are the most important to Pete into my future, whatever that may be. So it's really important.
Talk to me about this painting behind you, Sarah. There's a very significant meaning in that for you.
Yes, so this painting here is called Vulnerability, and it was painted by a nun from Jamboree Abbey, and it shows 3 people in a boat. And I have that hanging in my office to really remind me that patients and families that come here often feel very vulnerable entering into what is uncharted waters for them. And we can see it's a very rocky, stormy situation, and like I was talking to you earlier about Peter feeling very overwhelmed by what was going on, that's a common experience. And it's significant, I think, that we can't see an oar here. However, the 3 figures are sort of leaning in, and in palliative care, what we really do is teamwork. So, of course, I don't work in isolation. I work with the patients and families, and I'm supported by a multidisciplinary team. And I like to think sometimes that my role is that of providing an anchor or providing an oar, giving help to actually navigate these difficult times.
Sarah has told me that you said that you're travelling hopefully while preparing for the worst.
Yes. We're not really preparing for the worst because it's not really that worse. All I have now is optimism. I have some time. The only downside for me at the moment is I had a period where I was gallivanting around New York and Iceland, jumping into cold water, where I had an uncontrolled cancer that no one knew was happening, and in all that time it was doing some major structural damage. And I've got that. I've got numbness, and I know that there are some things there that aren't normal. But what I have is I have solved so many other issues that I had: pain, how I'm going to end my life, what it's going to be like. Am I stressed about it? No. Am I going to have clear head to the end? Absolutely. Am I fearful of anything? No, nothing.
Nothing?
No. It's good. And they gave it to me.
Peter, what a privilege to talk to you.
A pleasure.
Thank you so much.
You're welcome.